Dear viewers, this video is part 2 of the two-part series on tobacco. Cancer. Tobacco smoking causes cancer of the lung, lip or oral cavity, pharynx, nasal cavity, paranasal sinuses, larynx, esophagus, stomach, pancreas, liver, colon and rectum, kidney, ureter, urinary bladder, uterine cervix and acute myeloid leukemia. There is evidence suggesting that cigarette smoking may play a role in increasing the risk of breast cancer. The risks of cancer increase with the increasing number of cigarettes smoked per day and with increasing duration of smoking. Additionally, there is synergism between cigarette smoking and alcohol use for causing cancer of the oral cavity and esophagus. Among asbestos workers, there is similar synergism between cigarette smoking and asbestos exposure. It takes a minimum of 4 years to have the benefit of stopping smoking as far as risk of cancer is concerned. But even 20 years after stopping smoking, there is a modest increased risk of developing lung cancer. Smoking and lung cancer. Agents in smoke have a direct irritant effect on the tracheobronchial mucosa, producing increased mucus production, that is bronchitis. Components of cigarette smoke, particularly polycyclic hydrocarbons and nitrosamines, are potent carcinogens. They are directly involved in the development of lung cancer in humans. The toll taken by non-malignant conditions associated with smoking is even more terrible. Agents in smoke have a direct irritant effect on the tracheobronchial mucosa, producing inflammation and increased mucus production, that is bronchitis. Cigarette smoke also causes the recruitment of leukocytes to the lung with increased local elastase production and subsequent injury to lung tissue. Dear viewers, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Respiratory disease. Cigarette smoking is responsible for 80% of COPD, that is chronic obstructive pulmonary disease. Within 1 to 2 years of beginning to smoke regularly, many young smokers will develop inflammatory changes in their lung tissue. Tissue damage in the lungs manifest and progress over longer durations of smoking. Chronic mucus hyperplasia, that is increase in the size of the mucus cells of the lung, results in a chronic productive cough. Chronic inflammation and narrowing of the small airways result in pulmonary emphysema. Pulmonary emphysema can reduce expiratory, that is breathing out, airflow sufficiently to produce clinical symptoms of respiratory limitation in smokers. Note, pulmonary emphysema is a chronic lung condition. It is often part of chronic obstructive pulmonary disease, a group of lung diseases that cause airflow blockage and breathing problems. It develops very slowly over time. It is most often caused by smoking. Changes in the small airways of young smokers will reverse after 1 to 2 years of cessation of smoking. After stopping smoking, there is a very gradual return of lung function toward normality. Pregnancy. Cigarette smoking is associated with several maternal complications of pregnancy. There is also a small increase in the risk of spontaneous abortion among smokers. Infants of smoking mothers are more likely to experience preterm delivery, have a higher mortality rate, be small for their age. Smoking during pregnancy may develop cleft lip in the fetus. They are more likely to die of sudden infant death syndrome and appear to have a developmental delay for several years of life. Other conditions. Smoking delays healing of peptic ulcers, increases the risk of developing diseases of teeth, diabetes, active tuberculosis, problems of the immune system, including rheumatoid arthritis, osteoporosis, senile cataracts, and macular degeneration, that is the most sensitive part of the retina. The macula loses its visual function, hence, the finer details of vision is lost. Premature menopause, wrinkling of the skin, gallstones, and cholecystitis in women, and male impotence. Diabetes and insulin resistance. Tobacco increases levels of insulin antagonistic hormones, impairs insulin sensitivity. Reproductive outcomes. Adverse effects include damage to the umbilical cord structure, miscarriage, increased risk for ectopic pregnancy, low birth weight, placental abruption, preterm birth, and increased infant mortality. Conditions of the nasal cavity. Mainly from inhaled toxins and tar particles from snuff and smoked products. High concentration of free radicals, which induce oxidative stress and inflammation, producing primary ciliary dyskinesia, that is, decreased or even absent movement of ciliary processes in the respiratory tract. Sinonasal diseases, particularly sinusitis and rhinitis, are common in smokers. Sexual disorders. Men declines in fertility and sexual potency. Women decreased libido, increased cardiovascular disease while using oral contraceptives. Early menopause. Dental conditions. Besides malignant and potentially malignant lesions, other conditions are smoker's melanosis, keratotic patches, nicotinic stomatitis, palatal erosions, and periodontal disease, nicotina stomatitis. Other consequences: low bone density and frequent fractures, chances of age-related macular degeneration, poorer sense of taste and smell, accelerated aging, increased absenteeism, decreased work productivity. A quotable quote: "It does not matter how old you are or how long you have smoked. You become healthier and stronger each day you are tobacco free." Environmental tobacco smoke. Long-term exposure to environmental tobacco smoke increases the risk of lung cancer and coronary artery disease among non-smokers. It also increases the incidence of respiratory infections, chronic otitis media, and asthma in children, and increased risk of breast cancer. Cigarette use is directly related to myocardial infarction, that is MI, heart attack, increased rates of sudden death, aortic aneurysm formation. Aorta is the largest blood vessel in the body, arising from the heart, having localized dilatation of its vessel wall, that is the aneurysm. Peripheral arterial disease of limbs, especially lower limbs. Intracranial hemorrhage, that is brain bleeds, bleeding between the brain tissue and skull or within the brain tissue itself, can cause brain damage and be life-threatening. Some symptoms include headache, nausea and vomiting, or sudden tingling, weakness, numbness, or paralysis of face, arm, or leg, and subarachnoid hemorrhage. A subarachnoid hemorrhage is bleeding in the space between the brain and the surrounding membranes, that is the subarachnoid space. The primary symptom is a sudden severe headache. Smoking. Smoking increases blood pressure, contracts blood vessels, contributes to blood clot formation, that is thrombosis, or in atheromatous plaques, increases the tendency for coronary artery constriction, that is coronary spasm, increased tendency for irregular beating of heart, that is ventricular arrhythmia, responsible for insulin resistance, which in turn is a causative factor for atherosclerosis. Smokers on an average lose about 10 years of their expected life. Smoking increases the risk of oral contraceptives, causing premature coronary heart disease, stroke, and venous thromboembolism, that is, obstruction of a blood vessel by a blood clot that has become dislodged from another site in the circulation. Secondhand smoke also contributes to coronary heart disease. Secondhand smoke, that is the smoke from burning tobacco products like cigarettes, cigars, hookahs or pipes, and smoke that has been exhaled or breathed out by the person smoking. In 2011, approximately 600,000 non-smokers died as a consequence of exposure to secondhand smoke. Smoking greatly amplifies macrovascular, that is bigger blood vessel risk. Smoking may also accelerate the progression of nephropathy, that is kidney disease, and possibly retinopathy, that is retinal disease. Many people, especially young women, continue to smoke as a means of keeping thin and because they fear gaining weight if they stop smoking. Nicotine reduces fondness for sweet, energy-dense foods and may also be mildly thermogenic, that is, increasing body temperature and hence burning up of body calories. Weight gain after stopping smoking averages 3 kilograms, but about 20% of cases gain more than 6 kilograms. The risks of continuing to smoke are much greater than the degree of weight gain if smoking is stopped. Passive smoking caused 600,000 premature deaths, that is 28% among children. Among the adult deaths, about 64% were women. Pharmacological support to overcome nicotine dependence, including the use of nicotine replacement antidepressants, example bupropion, nortriptyline, and other drugs, increases the chance of quitting by around 2 to 3 fold. Electronic cigarettes, that is e-cigarettes, are battery-powered devices with cartridges that contain nicotine, flavors, and other chemicals which are inhaled as a vapor. These are a popular substitute for smoking as they are cheaper, widely available, and probably less harmful than cigarette smoking. However, there are concerns about their long-term safety as clinical trials to ascertain safety have not been performed. There are also concerns that the sweet flavors and bright colors may encourage children to use the products and develop a nicotine addiction. Prevention. Approximately 85% of individuals who become cigarette smokers initiate the behavior during adolescence. Factors that promote adolescent initiation are parental or older sibling cigarette smoking, tobacco advertising and promotional activities, the availability of cigarettes, and the social acceptability of smoking. The need for an enhanced self-image and to imitate adult behavior is greatest for those adolescents who have the least external validation of their self-worth, which may explain, in part, the enormous differences in adolescent smoking. Prevention of smoking initiation must begin early, preferably in the elementary school years. Physicians who treat adolescents should be sensitive to the prevalence of this problem even in the preteen population. Physicians should explain that all forms of tobacco are both addictive and harmful. So, dear viewers, this is the end of part 2 in this two-part series on tobacco. Thank you for watching the videos.